In 2022, 150 million Americans were prescribed eyeglasses. But what does the process of being fitted for glasses look like? In this episode of OCuTALK, Dr. Kerri-Ann Hodge will be telling us all about the testing and fitting procedures, the follow-up visits, and the ongoing maintenance for eyeglass wearers. Dr. Hodge?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Everyone, please welcome Dr. Kerri-Ann Hodge. Dr. Hodge, thank you so much for joining us today.
Well, it's an honor to be here. Thank you, Nick. And I'm so excited about our show today.
Well, fantastic. Well, we're very excited too, Dr. Hodge. And again, thank you so much for joining us. So, Dr. Hodge, before we get into our conversation today, I was hoping that maybe you can just introduce yourself to our audience, let them know a little bit about your background and your specialty.
Okay, great. So my name is Dr. Kerri-Ann Hodge. If you hear a little accent, I'm an island girl, was originally from the island of Jamaica. So growing up on that beautiful island, I only dreamt of being an eye doctor. And that was because I saw my dad struggle with his vision, and I truly wanted to do something about that. So I came up with this crazy idea that I wanted to go and help him. So that idea has never left me, and it has led me into this space, which is I'm a registered nurse, and then went back to school, optometrist, named a practice after my dad, D. Cordova Eyewear, giving back to the community of Jamaica, giving eyeglasses, frames, and exams to the kids there. So I am honored to be here, and I just love OCuSouth. So when they said, hey, come on over, I was so tickled and so excited. So I hope we have a great conversation today.
So how common is it for people to need glasses or corrective lenses?
Okay, absolutely. So in 2022, they said 150 million Americans had a refractive error. So what does that mean? So refractive error means that you need a glasses prescription, okay? So wow, that's a lot. So not only there, in looking towards visual impairment or blindness, 2.2 billion of that is from refractive errors. So you're talking about people needing glasses or contact lenses to see, which they are complaining of blindness or visual impairment. So that's an issue. The other thing is that people will see, but they can always see better. So there is a great amount of need for a prescription or refractive error or glasses, which the question that you just asked. So definitely, that's a lot of numbers, isn't it?
That definitely is a lot of numbers. Thank you, Dr. Hodge. And so how do you know if you need glasses?
All right. So how do you know if you need glasses? Many people will say, hey, I see just fine. And then you take them kindly to the back and say, okay, let me show you, you can see better. So how do you know that you need glasses? It's not an internal or a personal view. You need an eye examination by the eye doctor just to determine if you need glasses. So that's the first step. Not a screening. A screening just checks your vision. So you can be 20/20 blurry, 20/20 double, 20/20 unclear, but you can even be better, 20/15 or 20/20 clear, 20/20 without doubling. A better view of vision. So an eye exam is needed.
Gotcha. And so do you know by any chance, or do you see a common age as to when someone would probably need corrective lenses?
So that's a great question. So I say the 3Ds, okay? A common age is one, developmental. So for kids, as they develop, parents may be concerned, hey, my child is not doing this, the eyes are not aligning, things are not happening like they should. Also in that developmental stage, you have children. So you have school screenings, kids are not performing well, So those are some developmental concerns that's a common stage where things are caught. Another stage is driving. I know the first time I needed glasses was driving. As far as I thought I was able to see, but I could not see well. So during driving, you do a test. And so if depending on how well you do, 20/40 or better, you will pass the test, and you will know that you are not you can see or you cannot see. But at that stage, driving is always one of a points that we always find that patients need help seeing. Another point is the demand. So the demand of life, or even driving. You may be able to see well, or you pass the driver's test, but you are not seeing as clear as you like. So the demand for maybe computer work, you can see your computer work, but maybe your eyes are getting tired. Also, demands come very much so after 40, right? That's the age where you're like, okay, I can see that well after 40, and now the demand for glasses is needed. So I like to say the 3Ds, development, driving, and demands, are a couple of the times when we know that we need some help.
Gotcha. Perfect. And actually, you just spoke about it with development, and then I think you touched on it a little bit with the children. How young can people actually start wearing glasses?
That there is not an age for where you can start wearing glasses. I just love those videos where you have these little babies and they put on the glasses and their eyes open up and they can see mom and dad. Those are the cutest. But there is truly not an age. If there is a need, that assistance is given. But however, between the ages of 1 to 2, so if the prescription is, if you're nearsighted and the prescription is greater than a -4, hey, we're going to give you some glasses. If you're hyperope and your prescription is over a 5, hey, we're going to give you some glasses. Or the astigmatism, the irregularity over 2.5, we're going to give you glasses. So those numbers are called diopters, the steps that we go in with glasses prescription. Or sometimes just the eyes being different. One eye could see very well, extremely well, and the other eye not so well. So at that time, you want to give glasses. So there's truly not a just restricted age.
Gotcha, Dr. Hodge. I appreciate that. And so let's say it's determined now that someone in your chair needs glasses. What's that fitting process like, and what's that all process entail?
So that process, I like to call that 3 O's. First, you need your optometrist to examine your eyes, get those eyes checked, see if you're nearsighted, see if you're farsighted, see if you have some astigmatism, see if you need some reading assistance, see if you need prisms. Those eyes need to be aligned, not seen straight, or, and then also with the complaints or the exam finding, now we may recommend a material. Hey, do you need to wear your sunglasses more? Do you need to have blue light protection? What about those glares at nighttime? So we're prescribing that need. Hey, do you have migraines? You need a special tint lens for your migraines. So that is having the right prescription. Now going to the other O, optician. So the optometrist gives the patient your prescription for the eyes, hands it over to the optician, which fits you in your beautiful glasses to make sure that they fit on properly. That is the right pair of glasses to kind of match with that prescription. If that prescription is too high of a prescription, has tons of are you going to get reading help? How are they positioned on the eye? So the optician does a fantastic job to make sure that that frame, aligns with the prescription and the materials for that patient. And don't forget about the last O. It's, oh my, look at you. It's the patients. We have to give them what they want. What do you want? I had a patient that came in and she only wanted all black. So she had to match her uniform. She had to have no symbols, no signs on the glasses. It had to be straightforward, right? So what does the patient want? And some people may want not to stand out that much, or you may want to stand out. You may want to have lots of fun with your glasses. You may want to have multiple pairs of glasses. You may want to make a statement with your glasses. So marrying all those three components to the prescription, to the right glasses, to making sure that you have a oh my statement. Oh my, you look great. So, and making sure that patient is happy.
Well, I'm loving the three O's, the three D's. I love that everything that you're putting here, Dr. Hodge. Well, I appreciate that. So once someone has their glasses and they go through all the three O's with you, and they finally look amazing, and they go out of your office, how often does someone have to come see you again once they have their glasses? How often should someone come see their eye care professionals once they have their glasses? Is it once a year, or how does that work?
So that's great. We want to see you every year. At once a year is definitely the key. Catching things sooner and quicker is key. But, your doctor may need to see you a little bit more frequently. There are other examples like dry eye. Your doctor may need to manage glaucoma, cataracts, macular degeneration. So you may go in more frequently than a year. But a year is definitely the annual standard of care. Every year you should get your eyes examined, not when the glasses break, not when you think the prescription has ran out or what that means, but when every year, once a year is needed for an annual healthy eye exam.
Fantastic, Dr. Hodge. And I think you just spoke about it, but how, and I know it changes for some people, but how often does a prescription change with someone? I know like over time, like our eyes change and everything like that, but how often should our prescription change over time?
So that is great. So when I say a year, you're thinking, okay, that prescription is going to hang in there for a year, right? But I have a funny story. I had about an 11 or 12-year-old. We did an eye exam, great exam. And she came back 3 months after saying, I could not see. I think you didn't do a good job. I was like, well, let's come on back and check. Looking at her range, her parameters were like this, constantly going up. Nearsighted myopia. You know that at this age, between 6 to 16, the prescription changes drastically, right? So that prescription may not hang in there for a year before it changes. It may change pretty frequently as far as that growing spurt that we're going through with our 6 to 16 years old, okay? Now we're talking after 40. Hey, you're going to get some changes there. After 40, your prescription is definitely going to change. When does it change? I'm not the eye god, but it does change. Now, what can you do to help your eyes from not changing? You can take care of yourself. Take care of your blood pressure, your blood sugar, maintain a healthy weight, a healthy lifestyle, protect the eyes, wear sunglasses. So those are some of the things that can help to stabilize your vision without them changing drastically over time.
Well, those are fantastic tips and fantastic eye care maintenance. Speaking of eye care maintenance, I wanted to ask you, do you have any like eye care maintenance tips for like any eyeglass wearers or anybody who's wearing corrective lenses?
Absolutely, absolutely. So don't overlook protection. UV protection is one of those that often is overlooked. And just the UV blue light with a computer devices. But guess what? What about those lashes? Those lashes need hygiene protection. So we wash our hair every week or every day. We brush our teeth every day. What do you do for the eyes? I always tell patients that you have to do something about taking care of your eyes daily. So cleaning your eyelids and having healthy hygiene is super important.
Well, fantastic. And you actually just said it. So I wanted to ask, how important is eyelid hygiene, for people who wear like glasses or corrective lenses?
Oh, it's something that we really should put this as the eye care regimen for all, starting from a little baby. So, I know you guys are my friend. I have all the OCuTALK layout here. So OCuTALK is like your toothpaste. You may grab a toothpaste for to get more whitening, more cavities. So you should be cleaning your lids daily, whether it be for allergies, whether you have some extra buildup, whether you have Demodex. So this is super important. It should really be the regimen of care for the eyelashes. So the eyelashes are so important where they are cosmetically, right? We care about beauty. They look healthy, they look beautiful. Not only that, they're able to provide the eyes with correct moisture. So your eyes are hydrated, your eyes are healthy. And guess what? That will promote eyelash growth. So your eyelashes will now grow.
Well, all fantastic information, Dr. Hodge. Thank you so much. And I wanted to also ask you, when you go to the eye doctor and you also go to the optician, you see all those different types of glasses. Like, are there different types of glasses? Like, I know that they're probably different forms. Everything looks different, but are there different types of glasses?
Absolutely. So the glasses can range from just different shapes. So I have a few here. So I have a few different shapes here. You can have different shapes, not only the shapes, but the material, right? So the material that an eye glasses is made from can be a different material for each. Not only the material, but the lenses, right? So the lenses that your optometrist prescribes can be different for all three. Lenses can have single vision lens, bifocal lens, have prisms. So glasses, they are very simple yet complex and sophisticated. So different material, different shape, different lenses. Glasses are just fun.
Well, they definitely are fun. I remember having them as a kid, so they definitely are fun. But I wanted to ask you, and I know you probably touched on it before early on in the interview, but I wanted to ask again. So let's say someone has glasses. Does their vision change over time while still wearing glasses?
All right, so vision glasses helps a person to see better. So the vision will change based on that individual, not the prescription or the glasses allowing that change. So changes occur based on your responsibility to the self-care and also just your growth and development and changes within your body, not the glasses allowing that change, but that glasses truly assist and aid with you seeing well.
Fantastic. And I've heard I think you've heard the myth too, but wearing glasses can make your vision worse over time. Is there any truth to that by any chance?
Now that is such a myth, and it's one that is truly a powerful one that we truly have to help our patients to understand. So your glasses does not make your vision worse. What happens is you appreciate good things, great vision, and you appreciate clarity. And so what happens is now your demand may increase as we talk about the aging growth, where you need more assistance. So they may piggyback. Now you have received the help from your eye doctor, your optician, and picking out the oh my look. But now that has encouraged you to say, wow, life is good with these glasses on, right? So when you take them off, you're like, oh, this made my vision worse. No, you are now appreciating the clarity, the best vision that you can ever have. But it does not, absolutely not make your vision worse. So glasses does not make your vision worse. It helps you. It enhances your lifestyle. It makes you a better person. And it's so good for you. Just look good while wearing glasses.
That is amazing information, Dr. Hodge. And before we leave our conversation today, was there anything else that you'd like to let our audience know about?
No, so grab you some eyelid cleaner, OCuSoft. My friends, OCuSoft is like grab you some type of toothbrush just for the teeth, but this is for the eyes. And if you're not sure, always see your eye doctor to recommend the right one for you. I'm so honored to be here. We had so much fun. Thank you for having me, and I hope to be back again soon.